If you'd like
Yeah.
to ask your question, please.
Alnoor, it was a excellent presentation and thought-provoking as well. I just wanted to ask you, what is the future of the chronic heart failure after you have given sacubitril A2 blocker and beta blocker and furosemide? Is anything else can be added in the future? What do you think is coming up?
That's an excellent question. Again, very sophisticated, and you are dealing in the realm of research that's just coming out over the last few months. And thank you for giving me the opportunity to explain that. So when you have heart failure, the heart muscle is not able to pump properly, and so it's weak. And you want to do things that are going to improve the heart function. So you can improve the heart function by making it contract more.
Right.
So you can whip the heart, and it's like a donkey whose leg is broken and he's got a load on his back and he's going uphill, and you keep whipping him. It's not a good way of handling the problem. But we used to do that with digoxin for years and years, but we don't use that now. So you can do that, or you can work on the neurohumoral endocrine system of your heart. So you say to me, why are hormones and nerves and stuff important when we are talking of heart failure? They're important because they release certain neurotransmitters and hormones that worsen the heart function. And these are sympathetic type neurons, chemicals like norepinephrine and epinephrine and dopamine and those kind of substances. So what these newer drugs do is they alter the sympathetic tone in your system. So the sympathetic tone is what jazzes up your heart rate goes up, blood pressure goes up. The parasympathetic tone allows your heart to slow down, makes everything calm, and all that kind of good stuff. So there's a balance between sympathetic and parasympathetic system. And these drugs work by toning down the sympathetic system, which is harming the heart. So what it is doing is this donkey with the broken leg who is going up the hill, it's not, now we are not whipping it. We are taking off half the load on his back. And so it makes it easier for the donkey to get to the top. So it is unloading the heart. So the beta blockers, what they do is they tone down the sympathetic system because they block the beta receptors, and the sympathetic system works through the beta receptors. So once you block the beta receptor with a beta blocker, then you block the sympathetic system. So they improve heart function, and they prevent the arrhythmias from occurring, prevent the electrical disasters of sudden death.
Okay.
And what sacubitril does, sacubitril is a combination of two drugs. One drug is an angiotensin receptor blocking agent called valsartan, and the second drug in the same tablet is a neprilysin inhibitor called sacubitril. And so these two drugs work by unloading the heart. So what they are doing when you take these drugs is they're taking the load off the back of the donkey. So he doesn't die and collapse going uphill, but gets to the top. So they are unloading drugs, right? They work through the neurohumoral system. So we can do through the angiotensin receptor blocker, and now we can do it through the neprilysin inhibitor. And when we combine the two, we get a much better benefit for heart failure.
Okay.
So now you've used a beta blocker, you've used a neprilysin inhibitor, and you brought in the word Lasix, which tells me that in that patient's situation, there is still fluid overload. There is still excess fluid, and he still needs to get rid of the fluid by taking a diuretic Lasix to get rid of the excess fluid. So that's the only thing Lasix does. It just gets rid, a diuretic gets rid of the excess fluid. It doesn't strengthen your heart, doesn't improve the cardiac output, it doesn't stop the arrhythmias, it doesn't stop sudden death, it doesn't prevent long-term death. None of that. It's just a symptomatic treatment to get rid of fluid. So in the past year, we have this new class of medications called SGLT2 inhibitors. These drugs were developed about 5-10 years ago for diabetes because they bring down blood sugar. And when we were giving these medications to diabetic patients, we realized that these patients ended up getting less heart attack and less admissions for heart failure. So this was a drug developed to treat blood sugar, but ended up preventing heart failure and heart attacks and death. So we realized that it had a neurohumoral activity against the noxious chemicals that are present in a heart failure patient.
Okay.
So over the past year, there have been 3 or 4 major studies done across the world, randomized, double-blind controlled, which have absolutely 100% proven that whether you have diabetes or not, when you take an SGLT2 inhibitor, you are going to have benefit for your heart failure. You're going to get less hospital admission for heart failure, and you're going to get less death from heart failure. So there is this new class of drug, which is called the SGLT2 inhibitors.